welcome everyone to Zeo Skin Health Anti-Aging Virtual Webinar. Introduce myself. My name is Traci Benstein and I'm Senior Manager for International Training. I've been with Zeo for over 5 years. Please know it is absolutely my honor to be here presenting our anti-aging protocols to you all, as well as working directly with Dr. Obagi, our Chief Scientist, Rick Wooden, as well as Dr. Bashi. So I'm going to go ahead and close my webcam, and we'll go ahead and get going with today's presentation. So first, at Zeo Skin Health, we provide comprehensive solutions and a systematic approach for improvement of all skin layers, minimize negative responses, enhance barrier function, easily adapted treatments, and preventive protocols. A common thread throughout all of our Zeo products, our product line takes a holistic approach to formulating. We take into account the whole formula, adding hydrators and lipids to restore and maintain barrier function. Zeo also adds antioxidants to our formula, providing neutralization of free radical damage to prevent intrinsic as well as extrinsic aging of the cells. And lastly, we strive to utilize anti-inflammatory agents to support the skin's immune response and prevent chronic inflammation. This truly creates the perfect synergy. It's like the checks and balances to ensure skin health restoration. So as you heard Dr. Obagi mention earlier, the principles of skin health restoration, these are really the core principles that serve as the driving force behind all product and protocol development. These principles go beyond the traditional approach of treating diseased skin, and they serve as the foundation to provide a holistic approach to skin rejuvenation and maintaining healthy skin for life. The principles specifically focus on strengthening the skin, optimizing cellular function, eliminating skin sensitivity and chronic inflammation, resulting in the best treatment outcomes and achieving overall skin health restoration. Something that's also very special to Zeo are our exclusive complexes and ingredients. In front of you, our first complex is ZeoX12, which is an exclusive 12-hour time-release antioxidant complex of vitamin A, C, and E. These help to protect from free radical damage, prevent future signs of premature aging, and shield skin from harmful infrared A rays. And this is the heat from the sun, the near rays. Next is our Z-Pro, and this is an exclusive antioxidant biomimetic protein complex of hydrolyzed sericin and also Buddleia davidii butterfly bush, which is a powerful antioxidant used in Chinese medicine for many years. These two together help to enhance production of collagen and hyaluronic acid and also prevent future signs of aging, protecting against cell damage and collagen degradation. Next is our Zeo Redness Reducing System, and this is an exclusive plant stem cell complex of Rubium vulgare white horehound and also Leontampodium alpinium edelweiss. These two plants together are a powerful antioxidant protection and help to reduce redness and inflammation in the skin. Our last complex is new to us. It's our Z-Core, and this is going to be found in firming serum as well as wrinkle plus texture repair. This really helps to support the strengthening of the anchoring fibrils and the oxytalin fibers within the DEJ, the dermal epidermal junction. The ingredients here are kappa oil tetrapeptide 3 and an exclusive ingredient Melonotus officinalis, or sweet yellow clover extract. These ingredients help to provide key structural components to strengthening that dermal epidermal junction between the dermis and the epidermis, which will show improvement in sagging skin, so firming the skin, and also promote nutrient flow from the dermis to the epidermis, resulting in healthy skin renewal cycle, as well as encouraging skin's natural wound healing process. And here we need to talk about a keratinocyte maturation cycle, or KMC. The time it takes for a keratinocyte to form, mature, and exfoliate from the stratum corneum is known as a KMC, and it takes an average of 6 weeks. That's a nice, healthy cell turnover. Skin's normal barrier function is dependent upon a healthy KMC. The KMC is the foundation of skin health restoration because without adequate epidermal exfoliation and subsequent replacement with fresh active cells, skin health is compromised. It also allows skin hydration and prevents transepidermal water loss. A normal KMC allows the skin to maintain an effective barrier function and healthy water content. So the benefits would then include smooth, soft skin surface, thicker epidermis, reduction of bacteria, flora, comedones, and large pores, proper hydration, and uniform skin tone. So we're going to take a look now at the system of elevating our skincare. Zeo is a protocol-driven company. We know that this is a system in order to achieve and truly maintain healthy skin. One product cannot do everything. So the system first includes step one, getting your skin ready. This is the essential first step to achieving healthy skin. It is a simple system that works synergistically to normalize skin functions and optimize the effectiveness of all programs. Step two, prevent and correct, is customize your patient's treatment regimen by their concern, and protocol strength should be determined by your patient's individual skincare needs, from products that are to help keep the skin healthy and prevent future damage to more of an aggressive program that targets repair and restoration. Step three, protect. This is the final step in all Zeo protocols, is to protect the skin from UV damage. Zeo sun protection products maximize protection by offering the broadest, most comprehensive range of sun protection available. So this is a visual of how we build our protocols. You will see these products in all protocols, from anti-aging all the way to acne or rosacea. This is a great way to line up your products in office for your patients. And please know that we also provide prescription pads to send home with your patients on how to layer their products both AM and PM. So now we're going to take a closer look at building our protocol for anti-aging, starting with step one, getting your skin ready. This is truly getting your skin ready for everything, such as prepping the skin to accept our prevention and correction products. Just like we would properly cleanse and degrease the patient's skin for in-office treatments, we need to properly prepare the skin for our at-home topicals. So getting skin ready, we provide cleansers, we provide exfoliating polishes, as well as toners. So we have our hydrating cleanser for normal to dry skin, exfoliating cleanser for normal to oily, and then gentle cleanser for all other skin types. Our exfoliating polish for all skin types, dual action scrub for more oily acneic skin, and then our toning pads, complexion renewal pads for all other skin types, oil control pads for normal to oily skin, and then we have our calming toner for dry, sensitized skin. So getting your skin ready to cleanse is to normalize the skin with proper cleansing and remove surface debris. To exfoliate helps facilitate epidermal renewal, improve circulation, so the blood flow to bring the nutrients to the skin and take away the toxins, and also enhance product penetration. To tone the skin, we need to control the sebum, restore pH, and this will also enhance product penetration. So getting your skin ready is a system to cleanse, exfoliate, and tone that works synergistically to normalize skin function and restore overall skin health. Enhance penetration of active ingredients used in medical or non-medical regimens to increase their effectiveness and prepare the skin to effectively respond to solutions for the prevention and correction portion of skincare concerns such as acne, enlarged pores, redness, pigmentation, and rough texture. Earlier, I mentioned how Zeo takes a holistic approach in creating our products. So regardless if it's one of our cleansers or one of our high-potency vitamin A products, we're always protecting the skin. So January in 2019, we actually had a clinical that was published in Journal of Drug and Dermatology, so JDD, on our GSR system and the novel approach to treating photo-damaged skin. The clinical study, the objective here was to assess the efficacy and skin benefits of our three-step system, so the use of Zeo Getting Your Skin Ready treatment program. We utilized 35 subjects, and this was an 8-week study. Subjects were evaluated at baseline, week 2, 4, and 8. The protocol was to cleanse with gentle cleanser, both AM and PM, exfoliate with exfoliating polish every morning, tone with oil control pads, both AM and PM, And then subjects use their own self-selected SPF 30 or higher sunscreen as needed throughout the course of the study. We utilized quantitative metrics to assess the efficacy of GSR, such as instrumental measurements utilizing corneometry, cutometer, sebum, D-squame, and Visia camera analysis, as well as investigator assessment and subject self-assessment. To me, if the patients don't see the results, they're not going to stay on the protocol. So here, looking at instrumental measurements, I want to point out what we saw in the reduction in sebum presence. So we saw a 41% reduction, at the 4-week interval. We also saw a 24% reduction in dirt presence at the 8-week interval, and this is that fine particulate in the air. It's not the oil and the makeup in the skin. Using a Visia camera analysis with a 6 lighting modality, we saw a 31% reduction in pores. And then using a Visia camera analysis using a 2 lighting modality at the 8-week interval, we saw a 46% improvement in skin texture. I love this image. It really shows how beneficial just our GSR system can be. So investigator assessment, you can see every time the patients came in to be assessed, we saw a great improvement. But I like to point out that 4-week interval. We saw such a marked improvement. We saw a reduction in dirt by 68%, roughness 45%, sebum 69%, and redness 15%. Additionally, at that 4-week interval, we saw an improvement in smoothness by 52%, softness 51%, clarity 16%, and radiance, that healthy glow, an improvement by 17%. And again, remember, this was just with our GSR system, so you can see just how important it is to really make sure we're properly preparing the skin. So now we're going to take a look at step 2, our prevention and correction for anti-aging. So something to keep in mind, our protocols are really meant to help to customize our patient's treatment regimen by the skin concerns. Protocol strength should be determined by patient's individual skincare needs, and products that keep skin healthy and prevent future damage to aggressive programs that target repair and also restoration. So our prevent aging, acne, pigmentation, and redness protocols, really these prevention protocols are for all over healthy skin with little or no signs of skin problems, providing an essential tool necessary to keep skin healthy and prevent future damage and skin disorders. With these protocols, we expect no anticipated reactions. Next, we have our protocols. So when we actually see the visible issues, in this case with anti-aging, we provide moderate protocols. So again, those moderate signs of aging, they target fine lines, minor loss of firmness and elasticity, dull texture, and uneven skin tone. Really, in this protocol, you're going to see minimal to no anticipated reactions. Next, we have 2 severe protocols when it comes to anti-aging, and we're targeting different concerns. Our first severe protocol is for more advanced signs of aging, and it's going to target fine lines, wrinkles, loss of firmness and elasticity, mild surface discoloration, as well as sun damage. And then our last severe protocol, these are again for advanced signs of aging, but here we're targeting deep lines, wrinkles, severe laxity, enlarged pores, and textural damage. Retinoic acid may also be used for short-term use to accelerate the repair. Here we're going to see moderate to strong anticipated reactions. With ZO, we have a large portfolio really based on our patient's lifestyle. Anything for more sensitive patients who have never been on high potency products or protocols, and we really need to build that skin up, make it more strong and tolerant. Also for our patients that just don't want any downtime, they don't want to show anticipated reactions. And then patients that want to go aggressive and they're like, bring it on. They want to really get to that ultimate achievement as quickly as possible. We also have add-on products, and these are so beneficial, such as our enzymatic peel and exfoliation accelerator. And these really help our protocols with the vitamin A, so they help to turn the protein over a little bit faster. So we're going to see dumping that pigmentation a little bit more quickly, improving texture for our acneic patients, opening up the pores, Or maybe our patients cannot tolerate the high potency vitamin A's yet. And again, we need to have that exfoliation. Again, this is how we line up our products. You're always going to see GSR #1. Step 2, our prevention and correction. You're going to always see daily power defense, and then followed by our other prevention and correction products. And then step 3, protect from UV damage. In your protocols, we provide protocol guides as well as workbooks, and we lay out absolutely everything, so you don't even have to think about it. So if you have a patient that comes in with normal to dry skin, we're going to tell you exactly hydrating cleanser, exfoliating polish, and calming toner for that patient. A patient with more normal to oily skin, we're going to recommend exfoliating cleanser, dual action scrub, and our oil control pad. And then for all other skin types, gentle cleanser, exfoliating polish, and our complexion renewal pad. Now I want to show you our actual anti-aging protocols, starting with our prevention and then working into moderate and our 2 severe protocols. Remember step 1, you're going to go and you're going to hear me talking about this in your head. Step 1, getting your skin ready. We always have to prepare the skin with our GSR system. Step 2, for prevention and correction, I want to look at the prevention of aging first. It's always going to start with daily power defense, either morning or night, and then followed with our 10% vitamin C self-activating serum both morning and night. Step 3, protect your skin from UV exposure. Now, I want to point out in these protocols, you're going to see in our protocols where we add what's called Z-Boost. For example, if you have a patient that has large pores and they're concerned about that, maybe they're seeing great improvement with everything, but they're like, what can I do about my large pores? We're going to recommend both morning and night to utilize our instant pore refiner prior to daily power defense or after your GSR system. We can also use on one of our other Z-Boost systems, we can add our 10% vitamin C self-activating serum, and this is going to be applied in the morning after firming serum, okay? So let's take a look at our moderate protocol. So again, step 1, GSR, step 2, daily power defense morning and night, and then followed with the application of firming serum both morning and night, and then end with growth factor serum in the evening. Don't forget, in the daytime, step 3, protect your skin from UV exposure. Our next are severe protocols, and again, this one particularly for lines, wrinkles, and then sun damage. So we're going to see some probably dyschromia, that kind of that dirty appearance to our patient's skin. So again, daily power defense, morning or night, firming serum applied both morning and night, and then at nighttime after firming serum, we would recommend the application of radical night repair versus growth factor serum. And then step 3, in the daytime, protect your skin from UV exposure. Last, this patient, we're targeting deep lines, wrinkles, and texture repair. So again, after GSR, step 1, step 2, daily power defense, morning or night, firming serum, morning and night, and then our wrinkle plus texture repair or retinoic acid in the PM. And so remember, retinoic acid, we recommend no more than 5 months at a time. Step 3, protect your skin from UV exposure, of course, in the daytime. So the phases of skin health restoration, we definitely have different phases, and I love this. This is a great visual as well. So first of all, phase 1 is our repair phase. This is what we call the I hate it phase, and this is when we're going to see the most anticipated reactions for our patients. We're going to see the redness, the dryness, the peeling, sometimes even a little bit of heat and some inflammation. Phase 2, this is the I like it phase. So this is the improvement phase when anticipated reactions start to subside and overall improvement of skin health really starts to become noticeable. Phase 3, this is the completion phase, the I love it phase, and everybody forgets about that first phase, right? And this is when minimal to no redness or dryness or peeling persists and the skin's appearance is optimized. So we're really seeing that skin health has been restored. Once the skin has gone through each phase, the patient should begin a maintenance program. Each phase takes approximately 6 weeks to complete, if the patient is compliant and chooses to do an aggressive approach. If the patient is non-compliant, starting and stopping the program, or chooses a more mild approach, results will be achieved, but at a much slower rate due to the length of completion time of each phase. So the protocol selected must be used regularly to achieve maximum results. Remember, it's going to take 2 to 6 weeks just to begin to see transformation. And it's going to take 5 months of daily use for maximum results. Initial skin reactions are a good sign of repair. And then reactions can also be easily controlled by adjusting protocol strength. If you need to stop the skin's reaction, let's say you have a special event coming up, you can always stop using the product at least 4 days prior to the event. The objective of the principle of hydration and calming is really to reduce skin dryness, and this is as needed, also reduce irritation and the severity of anticipated reactions. Integrating a product with hydration and calming benefits into a patient's daily topical skincare regimen makes the process of skin health restoration more tolerable, which will result in an increased overall compliance. This is particularly important during the first phase of treatment. So remember that I hate it phase. And when the patient's skin has not yet reached that full tolerance to the program and is still experiencing redness, dryness, peeling associated with the use of topical retinoids. So now we're going to take a look at what we provide in our clinical studies. So really the science behind our products, we provide so many clinicals for our physicians' offices. And really, again, this is showing how beneficial our products are and really what they can do for our patients. So please note that we provide these physician sales aid on our clinicals, and don't hesitate to reach out to your local ZO account executive to provide this information if need be. So last in our protocol, step 3, protect our skin from UV exposure. Final step here, we offer triple spectrum protection to provide maximal protection from UVA, UVB damage, that non-visible light spectrum, HEV, high energy visible light, this is the blue to violet spectrum, damaging visible rays, and also infrared A, that heat from the sun, along with additional hydrators and lipids to protect skin barrier functions, antioxidants, and anti-inflammatory ingredients. Really, ZO has tried to think of everything to protect our skin when it's exposed to the environment. Depending on our patient's lifestyle, we have the sun protection for them. So what did we just learn? ZO is a protocol-driven company in order to provide maximum benefits and restore the skin to its most healthy state possible. And again, being a protocol-driven company, it's going to be starting with step 1, our GSR system. Step 2, prevent and correct, and really this is where we customize our patient's protocol based on their concerns. Step 3, protect against sun and HEV light damage. Again, we offer so many types of protections for our patients. And at this point, again, I want to thank you all for being a part of our presentation, our virtual webinar series. And I want to open up my webcam one more time. And again, thank you all for being with me. And I look forward to being able to work with you all in the future. So thank you so very much. And I wish you all a very blessed day, and take care, be safe.